Let's talk health now. A countrywide rollout plan is set to deploy 333 devices for diagnosing tuberculosis. The World Health Organization endorsed platform is expected to help in scaling up testing to combat tuberculosis and other infectious diseases. TVC News Kemi Balogo has more in this report.
The tuberculosis burden in Nigeria is identified mainly by the large numbers of undiagnosed and untreated cases. But recently, the use of technology has proven to be a game changer in the diagnosis and treatment of infectious and even non-infectious diseases globally, like TB. The TrueNat device is one of those technologies that will be deployed across all states in Nigeria and are expected to enhance TB and drug-resistant TB diagnostics in isolated facilities in the country.
The company looked at it and structured this machine to actually adapt into our system, where you can run it for 8 hours when it's fully charged. And it's not temperature dependent. It can stay as much as 40 degrees in an environment.
When people with TB come to a center by doing microscopy, half of them don't get diagnosed. And these people, when they go back to the community, are the ones that they keep giving TB to other people. So it's part of microscopy being used routinely for a long time.
A minimum of 8,000 more people are expected to now be tested daily, culminating in testing 2 million more people each year, which will further reduce the risk of community transmission while ensuring timely care.
The advantage is, one, is also going to help us to make sure that people don't spend more to go to where the other equipments are. Two, is going to also help us to increase our catch and also our case finder along the not just TB alone, but also for the drug-resistant TB pattern.
What we have now has what they call a solar power station attached to it. So what it means is that the current equipment we have deployed in Nigeria are going to be independent of power, so we don't have power issues, coming up as reasons for not being able to meet, the expectations of the funding partners.
Experts here say with Nigeria gearing up to reach the 2035 target of ending TB, improving techniques of diagnosis and treatment like this is a milestone achievement. Kemi Balogun, TVC News, Abuja.
Dr. Yusuf Aron joins me on the second half of the show to discuss what Nigeria needs to do differently with battling tuberculosis. Doctor, thank you for joining us on the program. We'll talk about the BPAL regimen shortly, but Nigeria appears to still have the highest TB burden in Africa. They say about 268 people die from the disease every day. What's your assessment of our current situation? How did we get here?
Tuberculosis is an infectious disease and is one of the leading causes of infectious deaths all over the world. Nigeria, not being an exception, is plagued with tuberculosis. It's caused by a bacteria called Mycobacterium tuberculosis. And one of the predisposing factors to it is airborne. It is transmitted through the air, and it is what? It is led towards overpopulation of people and infection through different means, such as coughing. Someone who can be infected. Now, there are different types of tuberculosis. We have the extrapulmonary tuberculosis. We have the pulmonary tuberculosis, which many people know about. That's the one that affects the lungs and the person coughs. We also have latent tuberculosis. Some people in Nigeria have tuberculosis, but they don't know because it is latent and it is undiagnosed. And we have the final one, the fourth one, which is active tuberculosis. So tuberculosis is a condition which is being diagnosed by different methods, such as sputum, acid-fast bacilli, mantle test on the skin. But the problem of Nigeria is poor education, overpopulation, poverty, population density, and also close congestion, people living in closed areas without proper ventilation. So these are part of the causes or the high-risk factors to tuberculosis, which many people have in our society. And the government needs to do something to reduce all these factors by providing primary health care services to people and educating them more about their health and how to prevent tuberculosis in the society. It's really a pandemic in Nigeria.
Absolutely. It's also estimated that one missed TB case can, transmit the disease to about 15 people in a year. And that has raised conversation as to how can we improve case detection, especially among children, to prevent for that transmission. I wanted to speak to the deployment of about 333 devices for diagnosis tuberculosis across the country. What do you consider the potential impact of this rollout plan, especially on enhancing our our testing capabilities in this regard? We may have lost connection temporarily with the medical doctor as we continue to explore the intervention and especially the kind of collaboration happening between Nigeria and international donor agencies in this regard. The B-Power regimen, for instance, we hear has shown a cure rate of about 90% in treating drug-resistant TB, and the conversation around the latest developments in treatment options are rife, and how all of that are being implemented in Nigeria. Dr. Around, if you can hear me, I was asking you about what you think about the potential impact of the deployment of about 333 devices for diagnosing tuberculosis across the country. Dr. Around, thank you for staying the course on the program. I was asking you about what you make of the deployment of these diagnosing devices across the country. We understand that about 333 of them are now being dispatched across the 36 states of the country. How much impact do you see that having in the fight against tuberculosis? Well, apparently we're still having difficulties connecting with the medical doctor. There are conversations also around community sensitization and the role it plays in the ongoing fight. We're looking at, for instance, the need to raise awareness at the grassroots, especially amongst local communities in the fight against TB. The doctor mentioned earlier that there are people who actually have the diseases and do not know. Because it is latent. Now, Nigeria is working with international partners such as the World Health Organization to combat TB. We're asking questions as regards how much impact these partnerships are contributing to the country's efforts to curb the disease, especially now that we have the highest burden in Africa and more than 200 people, we understand, die because of the disease on a daily basis. We're following developments with what we reported earlier as regards the devices for diagnosis tuberculosis and how the World Health Organization endorsed platform is expected to help scale up testing to combat TB and other infectious diseases in this regard. Dr. Around, if you're back, if you can hear me, quickly let's have your contribution as regards these diagnosis devices, how much impact you think they're going to have in our ongoing fight against the tuberculosis burden in Nigeria. Well, we may have lost connection with the medical doctor. We're going to continue this conversation subsequently as we begin to have some very robust conversations, especially now that we're entering into a new year, looking at government budgeting for the health sector and whether or not government is taking this seriously and prioritizing the need to change the figures in favor of the country, especially now that we now carry perhaps the biggest burden of this disease across the continent. That's our show today, everyone. Thanks for being a part of it. The conversation continues on X. Remember to use the hashtag Beyond 100 Days, tag TVC News NG and Nifemi Oguntoye. You can watch it again at midnight and at 6 a.m. tomorrow. I am Nifemi Oguntoye. See you again at the top of the hour.